We were discussing the antepartum hemorrhage and the speculum examination in the previous slide, in which we discussed that cervical dilatation and low genital can be visualized for the cause of APH by doing speculum examination. The 69% of the women had normal cervix and 21% had cervical retropion and 2% had dilated cervix. Now coming to the digital examination for which can be placenta previa is the possible diagnosis for the APH if the presenting part on abdominal examination is high and there is painless bleeding and the previous scan shows the low-lying placenta. So digital examination should not be performed until an ultrasound has excluded the placenta previa. Digital examination can be done if APH is associated with pain or uterine activity and cervical dilatation is assessed by doing the digital examination. What investigations should be performed in women presenting with APH? Like the maternal examination are done to assess the extent and physiological consequences of the antepartum hemorrhage. And the maternal investigations performed will depend on the amount of bleeding. The Clay-Hall test should be performed in the rhesus negative woman to quantify the feto-maternal hemorrhage in order to gauge the dose of anti-D